Welcome, everyone. Thank you so much for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General Hospital. Before we get started, just wanted to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Please note that everyone is in listen-only mode. Everyone has been muted so that we can hear our guest speaker today. If you have any questions for our guest speaker, you may use the chat feature, which is located at the bottom of your screen. We'll have time for them in the end. Only Blum Center staff and our guest speakers will see your question. Please do not share any personal medical information or questions in the chat box. If you have a personal medical question, please ask your doctor. All right. Dr. Luberto, would you like to pull up your slides?
Sure.
So while Dr. Luberto pulls up her slides, wanted to introduce you all to our guest speaker, Dr. Christina Luberto. She provides individual and group mindfulness-based therapy to help people cope with emotional and physical health problems. She is a principal investigator on 2 NIH-funded clinical trials to study mindfulness-based cognitive therapy for emotional and physical health improvement in people with heart disease. In collaboration with Dr. Bott, Dr. Luberto recently completed a research study of a mind-body resiliency intervention to reduce health anxiety in adult congenital heart disease. She is a Mass General clinical psychologist, researcher, and meditation teacher, as well as an assistant professor of psychology at Harvard Medical School. This presentation is part of Mass General Heart Center's Heartfelt Dreams Foundation, Expanding the Medical World webinar series. And she joins us today to give a talk on adult congenital heart disease over the holidays, coping with challenges, developing resilience, and talking to your doctor about feelings. So please join me in welcoming Dr. Luberto.
Great. Thank you so much, Amy. I'm very happy to be here with you all today and share a little bit about living well with ACHD during the holidays. Talking a bit about mindfulness approaches for stress management. So I'll share some slides, and then I will also guide us through a mindfulness practice as part of this talk, and then have plenty of time, hopefully at the end, for questions from you all. So in terms of just landing us in this moment of preparing for upcoming holidays, maybe religious or cultural holidays, or just the new year coming up, many of us experience a mix of feelings and emotions during this time. There can be a lot of joy and celebration, a lot of connection, and also some stressors. And it can be a really challenging time in many ways. So just to name a few of the stressors that can show up for folks, just financial concerns around this time of year, perhaps spending too much money, some social stressors, maybe having too much or too little time with family, or managing some stressful family dynamics. There can be a lot to do that can feel stressful. We might just feel like we have these never-ending to-do lists, that we're always sort of striving for the next thing we need to get done. There might be travel, some temptations for unhealthy eating or drinking. Maybe if we're entertaining others, that can be a stressor. And a variety of different emotions can come up. There can be feelings of loss or loneliness, or just general worries or stressors like these. And these are true for many of us, regardless of whether we're living with ACHD or not. And I also hear from folks some unique stressors that can happen living with ACHD during this time of year. So just to name a few of these that, I'm sure others here could educate me a bit more on, but we are still living in the time of COVID, and that again is stressful for many of us, but in particular, when living with a chronic condition like ACHD, there can be more fears of being social, being with others, and risk of contracting COVID. Just the physical symptoms that some folks experience living with ADHD can just add to some of the stressors and challenges. I've heard from some folks, things like travel or being too far from home can be difficult when there are a lot of physical symptoms happening. We might have changes to our health behavior routines during this time of year, which are often important to many people. It can just be harder to remember to do things like take a daily walk or take your medications at the same time when there's just so much going on. And then perhaps, some of this contributing to fears of changing your routine or traveling far from home. So for some of us, we might feel sometimes like this sort of grumpy cat here of actually feeling like our favorite holiday is the day after the holidays are over. So if you feel like this grumpy cat, you are in good company, and I'm going to share with you some strategies and tips that might be helpful. I first want to say a little bit about the relationship between stress, anxiety, depression, and some of the specific emotions that may come up during the holidays, partly to educate and partly to normalize, so that if you do feel any of these things, you can just know that you're not alone, and these are common experiences. So the first is just to say a little bit about anxiety. Anxiety is a future-oriented emotion, meaning that it's something that leads us to thinking about the future. All emotions include a few different components. So we have physical sensations that come with anxiety, of things like increased heart rate, shortness of breath, dizziness. The thoughts that often happen when we have anxiety are worries about the future, worries about physical sensations or our health. So sometimes we might worry about sensations in the chest, maybe arrhythmias or increased heart rate, and that can create more anxiety. And those symptoms can also be symptoms of anxiety. So there can be some confusion there. And when we have anxiety, we have a lot of urges to often avoid, escape, or sort of distract ourselves from how we're feeling in some way. I want to highlight that anxiety is a very adaptive and natural response to threats. The challenge sometimes is whether a threat is real in the moment or something that we're able to sort of just imagine in the mind, where there might not actually be a threat in the moment, but we're still having this anxiety response. Also wanting to note that anxiety sensations are uncomfortable, but that they are in and of themselves actually harmless. And these sensations and experiences of anxiety are time limited. So most emotions, some research suggests, actually last about 90 seconds. They rise, they peak, and then they pass naturally on their own after about 90 seconds, if we allow them to sort of ride that wave on their own. Again, anxiety is a natural and important emotion, and it only becomes problematic when it causes high levels of distress or impairment for you, meaning that it gets in the way of you doing the things that you care about in your life. Depression or sadness is another adaptive, natural response to loss or unmet desires in your life. Physical sensations of sadness are often heaviness, fatigue, feeling slowed down. When we have sadness, we often have negative thoughts about ourselves, other people, and the world. And we might have urges or behaviors of crying, withdrawing, or sleeping. Again, these sensations and emotions are uncomfortable but harmless, and they're time limited, and only become a problem, sort of turning sadness into a clinical depression, when these symptoms persist and cause significant distress or impairment in your life. I also want to highlight that anxiety, depression, stress are very common, again, during this time of year, but also just in general, particularly for people living with ADHD. So anxiety affects at least 30% of people with heart disease as compared to 20% in the general population. And same for depression, about 30% of people with heart disease versus about 10% in the general population. And some studies also show that anxiety about your health in particular can affect as many as 70% of people with ADHD. So again, we're not alone, and these are really common feelings and emotions to have. And there can be sort of this bi-directional relationship between emotional feelings and our heart health. So living with ADHD can create anxieties and create worries that impact our emotional well-being. For example, worries about physical symptoms that we're having, worries about the course of our health and how things will be in the future. Those types of thoughts can contribute to feelings of anxiety. And then on the other end, feelings of anxiety can contribute back into how we take care of our heart. So if we have worries about physical symptoms, for example, we might not exercise as much, which is, of course, not a good way to take care of the heart. So we see this sort of cycle of our emotions impacting our heart health and vice versa. So there is good news here. There are a lot of things that we can share with folks about how to manage emotions, manage stressors during the holidays and beyond to help build resiliency and take care of ourselves. So let me say a little bit about this idea of resiliency. We have done a lot of work here at Mass General in the Benson Henry Institute for Mind-Body Medicine with the concept of resiliency and how to build resiliency for folks. So we define resiliency as the ability to cope with the stressors of daily life. So not just the big acute things that happen, but just the day-to-day sort of chronic hassles and stressors that come up. It also shows resilience to be able to cope with those. In addition, resiliency can also refer to the ability to bounce back after we do have some type of significant, difficult event or traumatic event. Resiliency involves several things. So we think of resiliency as involving having an appreciation for life, being able to take positive perspectives, recognizing your personal strengths, being able to connect with others, and engaging in positive health behaviors. And for some people, resiliency can also include a sense of spirituality or religion. We know that greater resiliency is associated with fewer symptoms of anxiety and depression and fewer experiences of stress. And again, the very good news is that we know that resiliency is a skill that can be enhanced with practice. So we can all learn ways to build resiliency. So I'm going to share next a bit about some specific resiliency skills for the holidays in particular. So the first is a skill of appreciation. So what we mean here is being able to be aware of pleasant experiences. So sometimes when we're having a lot of stress, we just don't notice the pleasant things that are already happening. So this might mean actually pausing and noticing something positive that happens and just sort of telling it back to ourselves very simply. So for example, if you need to go shopping and drive to a store, you might actually notice and think to yourself like, oh, the parking lot actually wasn't that crowded. Like I actually was able to get a spot. Or if you have a conversation with a family member, you might appreciate afterwards of like, oh, that person didn't bring up something difficult or uncomfortable for me. That conversation went nicely. So just having awareness of the pleasant things that happen. Health behaviors are also, again, very important for maintaining resiliency. So this can include sleep, physical activity, and healthy eating. And many of us know this, and I just put it up here again to reiterate that sometimes it can take a little bit more intention and planning during the holidays to maybe wake up a little bit earlier if you can and get some walking or stretching in earlier in your day if you know you're going to have more to do throughout the day. Planning for healthy eating around meals, maybe starting with something light, some type of, veggie based healthy snack before going to maybe a party where you think you might be tempted to eat some more, things like that. Another resiliency skill that we emphasize is creativity. We actually know from some research that creativity brings a greater sense of joy and happiness for many of us. And many of us have ideas that like we're not creative, like I'm not artistic, I can't draw, things like that. But actually there are so many different ways to be creative, and whatever your individual way is for you is great. So for some people, it's organizing the way that they design their space and their home, or it can be crafting or knitting, it can be cooking, it can really be anything that gives you a sense of playfulness and creativity. Around the holidays, one way to build this in might be to think about what are some sort of thoughtful, personalized gifts that you could create for folks, cards, little crafts that you can give, maybe baked goods. So just sort of thinking about ways that you could share your creativity with others. Related to this is the resiliency skill of social connections. So in general, having social support, having people that we're connected to is very helpful for our overall well-being and for our resiliency. And during the holidays, this could look like a few different things. Volunteering or charity work might appeal to you. I think a lot about boundaries and how to balance our needs with the needs of others. And especially around the holidays where there might be a lot of requests or demands on your time, just to know that it's okay and it's healthy to set your boundaries with others and let them know what you can do and what you can't do. And related to that, also knowing that it's okay to ask for support, and knowing when you need to do that and who you can ask, and going ahead and making a request that you might need. I also wanted to add around social connections in the holidays, just some tips for constructive conversations with others, finding areas of agreement, changing the topic if things move into any area that you really aren't comfortable talking about, knowing you can change the topic. And sometimes just agreeing to disagree, knowing that we can't change necessarily how other people think. And sometimes for the sake of maintaining the relationship that we care about, we might just agree to disagree. Sometimes around the holidays, there can be feelings of grief or loss. And so if this shows up for you, some ways to bring resilience to working with those feelings are remembering loved ones in certain ways. So choosing the way that you want to celebrate the holiday, choosing the people you do or don't want to be with, the places you do or don't want to go, how long you want to be, celebrating or with other people for, creative sort of memorials, maybe again, bringing in some creativity, making some type of art craft to sort of commemorate your loved one, visiting a grave, leaving a creative gift at the grave, all of those types of things. I also wanted to talk a little bit about activity pacing. So as I mentioned, one of the stressors might be just the busyness of all of the things we need to do. And so, especially when living with a chronic condition like ACHD, this idea of activity pacing can be very helpful. So alternating periods of activity and rest. So this is different from just go, go, go and try to get everything done at once and then tire yourself out and feel sort of burnt out. And it's different from just rest, rest, rest and sort of having too limited activity. So it's finding that balance and alternating activity and rest. For some folks, just being a bit more organized can help to reduce a lot of stress during this time of year. Keeping a to-do list, maybe planning ahead for how much you're willing to spend around the holidays, both in terms of your finances and in terms of your time. And prioritizing what really is most important to you. And again, bringing in those boundaries and knowing that just because somebody asks something of you doesn't mean that you have to do that. This idea of non-striving is very related to mindfulness practice I'll talk about. But what it can look like in the holidays is just having realistic expectations for what the time of year might be like, whether it's gifts or the activities or the type of connections you have with others, just sort of allowing the reality to sort of be as it is and working within that rather than having maybe an opportunity to sort of disappoint or frustrate yourself by having unrealistic expectations. Another really important skill of resiliency is just noticing when we're starting to feel stressed and noticing what's causing our stress. When we know what's causing our stress, we can consider whether it's a stressor that we can control or change. And if we can, then we can take steps toward changing that. And maybe we might notice that it's an uncontrollable stressor. And what we work with instead is managing the emotions that come up. And so related to this is really just the overall picture of self-care and having coping skills for when, especially when there are stressors that we can't change. So these are skills like relaxation, mindfulness, and self-compassion. And that is what I'm going to talk about next and lead us through in a mindfulness practice in just a few moments. So some of you may already be familiar or even have practice with mindfulness, but just so we're all on the same page, one way we define mindfulness is the awareness that emerges through paying attention on purpose, in the present moment, and non-judgmentally. So basically, this just means paying attention to what's happening in the moment and having some openness and curiosity about our experience. I want to add that mindfulness is an ancient practice that comes from contemplative and spiritual communities in the East, in parts of Asia. And it's been brought into healthcare in the past 30 or so, 40 or so years as a way to improve well-being. And there is a lot of research now that demonstrates what ancient scholars and contemplative practitioners knew from their own experience, which is that mindfulness can really help us to build resiliency and reduce stress, anxiety, and depression. If you are a visual learner, you might appreciate just this slide that sort of depicts what mindfulness means. So it's sort of, you can think of it as the difference between having a mind that's full of stuff versus just being mindful in the moment. And so if you imagine maybe an adult and a child walking through a park, the adult, while their body is in the park, their mind is off worrying about things at home, finances, things at work, whereas the child is actually having their mind connected with their body in that moment and noticing, oh, the trees are green and the sun is out and I can feel that I'm holding this person's hand, and actually being present in that moment. There are a lot of different ways to practice mindfulness, and we know that the more we practice this, the more it can help us. There are formal practices where we take time out of the day, anywhere from 5 to 15 minutes, to sit down and do a mindfulness meditation practice like the body scan or awareness of breath or mindful yoga. And then we also have informal mindfulness practices, which are also really great because they don't take any extra time out of the day. So especially this time of year when we're very busy, it might be nice to know that we can bring this mindful awareness to whatever activity we're already doing, and it then becomes a mindfulness practice. So walking, eating, cleaning your home, all of those things are things that we can practice doing mindfully. So I'm going to pause us here and just lead us through a mindfulness practice together. I'm going to pull my screen down and I'm not going to share at this part. And then we'll come back to a discussion after. So I can't see any of you, but I hope that you are here and you are following along as you can. I'm going to offer some guidance over the next several minutes for settling into a mindfulness practice together. So I'll invite you to prepare for this if you'd like to participate by just going ahead and getting comfortable. If you're in a chair or if you're laying down, wherever the body is positioned, just noticing what would allow the body to feel a bit more comfortable right now and going ahead and making those movements, shifting position, whatever you need to just start to settle in. And if you are sitting down, one thing you might do is just invite yourself to sit up a bit straighter so the spine is straight, but still relaxed and soft. And this just embodies a feeling of being alert and awake, but still relaxed. And you can have the hands resting in the lap or at the sides. And the feet just flat on the floor. And if you're laying down, just noticing the length of the ground beneath you. Again, the hands can be maybe on the belly or at the sides. And the eyes can be opened or closed, whatever you're more comfortable with. So you could go ahead now and close the eyes or just gaze down at the ground a few feet in front of you. And just beginning by noticing the contact points between the body and the surface that you're on, and just noticing that in a very tangible way in this moment, you are supported, you are held by the ground or the chair. And just noticing how those touch points feel against the body. Does the ground feel firm or hard? Does the chair feel soft, warm? As best you can, just noticing however it is right now. And checking in with your current moment experience, whatever is here. Noticing what thoughts are moving through the mind. Noticing any emotions in the body. Noticing any sensations in the body. And as best you can, giving yourself permission to just allow your experience to be however it is right now. Knowing that however it is in this moment may be different in the next moment. And that anything else in your day can just be on the back burner. Right now, there is nothing else you need to do and nowhere else you need to be. Letting yourself settle in by bringing your attention to the breath, if that feels comfortable for you. Noticing a breath in and a breath out. And as you breathe out, letting that out breath help to release, let go, soften, helping you settle in a little bit more to just the fact that you're sitting or laying here in this moment. And as best you can, having an intention to just let your attention rest on the breath for the next few moments. You don't even have to try to breathe a certain way or change the breath at all. But just seeing if you can notice the sensations of the breath moving through the body. And as you notice the breath, there'll be thoughts or sounds that come up and bring your attention away from the breath. And that's okay. Just acknowledging when that happens and gently escorting your attention back to the breath. Allowing the breath to be an anchor, grounding you in this moment. And from this place, I'll invite you to bring to mind the picture of what the next few weeks might look like for you. So thinking about the upcoming holidays, just letting any image of that emerge in your mind. And just noticing what image comes to mind. Noticing any sensations that happen in the body right now, just at the image or the thought of the next few weeks. And noticing any emotions that come up at this image. And as best you can, whether it's a pleasant or an unpleasant thought or feeling, offering to yourself, saying to yourself in the mind, it's okay to have this thought or feeling right now. Maybe there's a mix of feelings, some feelings of excitement, warmth, also some feelings of tension, worry. Just noticing whatever thoughts or feelings are here, and in your mind, just labeling them, saying to yourself, excitement is here, tension is here, whatever it is. Noticing any shifts or changes that might happen just when naming the emotion or feeling. And if it's something unpleasant, giving yourself the reminder too of the common humanity of our feelings. Saying to yourself, other people feel this tension too. The holidays are hard for other people too. I am not alone. Continuing to breathe here with whatever your experience is. And knowing that now you can bring in some nourishment and some nurturing for yourself. So if your experience right now is pleasant, bringing in some savoring, letting your attention really rest on the pleasant feelings that are here, breathing into them, breathing with them, exploring in detail how they feel in the body. And if your experience right now is unpleasant or difficult, offering yourself some soothing, perhaps by bringing the attention back to the breath or to some other neutral or soothing experience. Maybe the feeling of the hands on the lap, or maybe listening for sounds around you. Letting your attention focus on this spot that you choose. Offering yourself, if it's comfortable, some soothing touch, perhaps placing the hands over the chest as a way to offer more warmth, more grounding to yourself. And inviting yourself to allow your inner wisdom to support you in this moment and in the next few weeks. So doing this by asking yourself silently in your mind right now, what do I need to hear? Or what do I need to remember? Allowing some space and silence for your inner wisdom to emerge with some ideas of what would be helpful for you to hear or remember. And if it's hard for something to come up there, you could also consider, what would you tell a loved one? And then going ahead and giving those kind words right to yourself. Just noticing what your experience is as you give these words to yourself. Maybe things like, I can be strong. I can be brave. I can take care of myself. I'm not alone. Whatever it is. Having just a few more moments, breathing in these kind words. Letting your attention be more broad again. Becoming aware of your whole current moment experience. Noticing how the body feels, what emotions are here. Noticing what the mind is doing. Having a nice deep breath in and out. And when you breathe out, letting that out breath release this mindfulness practice, bringing it to a close. Letting the body make any movements or gentle stretches to awaken back up to the larger space around you. And bringing your attention back toward the screen, toward our talk. Just welcoming you back to this space now, noticing this transition back. And would be happy to hear at the end in the chat if anyone has any questions or anything they'd like to share about the practice that we just did. I'm just going to begin to close us out with a bit more information that you can take with you. So I'm going to pull back up slides and just close us out a little bit. I'm happy to make these slides available. I know they'll be on the recording, but perhaps, Amy, we could talk if there's some way. I'd be happy to share them so folks can also have these written sort of instructions here. I won't read through them, but you'll have this available one way or another. And it just sort of describes the steps for some mindfulness practices that you could try. In particular, this is a very short practice. It's similar to what we just did, but just a few minutes. And a really nice way to use this during the holidays or whenever you're feeling anxiety or stress is to just step out of the space that you're in, step into another room, pretend you need to go to the bathroom, and just take 3 minutes to follow along with these steps of mindful breathing. This slide here shows steps of what we just did in this practice of how to really give yourself compassion when you're having a tough moment. So again, maybe during the holidays or any other time, these are some steps that you can follow. I'm also going to share some guidelines for the informal practice, as I was saying before, just not needing to take any extra time out of the day, but just bringing mindfulness to whatever you're already doing. Here are just some concrete ways of how exactly you can practice that. It can be very helpful to do these practices with somebody guiding you. So here are some suggestions for places you could get guided recordings, including the mindful breathing that I just showed for 3 minutes. I have some on my website, and then there are lots of apps that have some great meditations as well. If you're interested in mindfulness classes, things that include like 8 weeks of like a group mindfulness class, we have a lot of options for that at some of the partners hospitals at Mass General and the Brigham, and also at Cambridge Health Alliance. So there are some websites here where you could explore different offerings. And if you feel like you might need more support for mental health, Some resources here for how you could find referrals for a therapist at MGH or also in your community. So that is all. I'll pull down the slide here and happy to answer some questions and have a discussion.
Thank you so much for a wonderful presentation, Dr. Luberto. We are now at the end of the session. If you have any questions you'd like to ask, feel free to enter them in the chat box. So you had mentioned earlier on about how the holidays can be stressful. Do you have any additional tips you can share as we approach the holidays and we're meeting with family and friends on managing resiliency?
Yes. So it can bring up so much, right? What are the specific concerns or challenges that can come up with different family members or different friends? I think some specific suggestions would be if you know or you expect that a person or a conversation will be challenging for you, do a mindfulness practice right before. Give yourself a few minutes of coming into a calmer state. During the interaction, continue to pay attention to how you're feeling. And if you notice that the body is becoming too tense or too upset, recognizing in that moment that you can step out. If you choose to stay in the conversation, knowing that you can change a topic at any point, you can kindly say, I disagree, let's talk about something else. And that you can set boundaries with friends and family. You might say something like, oh, I'm happy to come. I can stay until 7, right? I can't stay all night. Tell them what you can do. I can stay until 7. And so setting those boundaries for yourself so that you're not in a situation that's too difficult for you for too long.
Thank you. The exercise that you led was extremely helpful. Is there any benefits to practicing this on a daily basis, even when we're not encountering a stressful situation?
Yes, that's a great question. It is particularly beneficial to practice this when we're not experiencing a stressful situation. You can think of it like learning any other new skill. The more you practice it, the more it will help you. And it's easier to learn when we're not feeling upset. So one of the original people who brought mindfulness into healthcare is John Kabat-Zinn, and he describes mindfulness practice as weaving a parachute. So if you were going to jump out of a plane, you would want your parachute to be ready, right? You would want to be weaving it for weeks and weeks and weeks so that when you get ready to jump, it's ready to support you. It's the same thing with mindfulness practice. If this feels like a helpful practice to you, we might want to practice a little bit each day or a little bit most days, even when we're feeling great, or especially when we're feeling great, so that when something challenging comes up, we have that foundation of skills that we can use.
Is there a better time of day to practice this?
Yes, another good, very common question. There's not a universal best time. It's really personal and whatever works best for you. So what I often encourage people to do is experiment and see, what is it like to try to add 5 minutes of mindfulness practice into my morning? What's it like to add it in the evening after work? And which of those works better for you? And sort of better is sort of like, which of those allows you to actually sit and get it done? Again, people will also ask, like, how much do I need to practice? And so that's a question that the research is sort of mixed on. We don't have like a perfect answer for it. So what I often say is any practice is better than no practice. And the more we practice, the more it helps. So I find that what's often reasonable for people is maybe 10 minutes a few days a week, if you can.
Thank you. Do you have any tips on how to best deal with finding out as an adult that someone has congestive heart disease?
Yes, this is a great question. It can be so jarring to get a new health diagnosis as an adult and really just sort of create a lot of change in our life. And so I think acknowledging that this is difficult and that we deserve some support, some guidance if we need, reaching out to counselors or therapists or someone who can sort of be with you on that journey through the transition of accepting this new normal can be very helpful. I think a really useful framework for managing big life changes or new diagnoses is thinking about what is within our control and what is not within our control. And so we can't control the diagnosis. We can't control that this is the new reality, but we can control how we respond to that, how we take care of ourselves in terms of health behaviors, and what perspective we sort of bring to the experience. So I think, really getting support is number one. And if you do prefer to sort of internally work through it on your own, journaling is often very helpful for just getting your thoughts and your feelings on paper, getting them a little space from you, giving you some perspective, and bringing some of these relaxation, mindfulness practices as a way to just have some way of decompressing with any of the anxiety or worry that might be going on.
Thank you. And you had mentioned that you'd be happy to share your slides. If anyone would like, feel free to email the Blum Center at pflc@partners.org, and we'd be happy to share that with you.
Great.
So we have one more question. Will your techniques help when my heart surgery is rescheduled 2 or 3 times?
Oh man. Yeah. So the frustration, the uncertainty, just the emotional challenge that can come up in that moment, right? I think this is a really good example of bringing these practices to things we can't control. So unfortunately, the healthcare system has its idiosyncrasies and things like this happen. So what I've heard from folks and from patients is that, yes, having a way of bringing your attention to the breath, to a comfortable place in the body, when we're having strong emotions like frustration or impatience, that yes, these practices can really help to deal with those emotions. It's not going to change the schedule and when you can have your surgery, but it will help you to manage the feelings that can come up around it. I had a patient recently tell me she went for an appointment and ended up having to wait over almost 2 hours, and that she actually used that time to practice mindfulness and practice noticing the space around her, and was really surprised at how that waiting time felt very different for her than it otherwise would have. So that would be what I would offer you there.
Thank you. So it looks like we have time for one more question. We who have a person who was born with CHD and just found out that their young son also has the same condition, which surprisingly, it's awful news. What can they do?
Yeah, this is tough. And I think this is another place of acknowledging the feelings and validating them for yourself, getting support around them, knowing what you've learned in your experience, all of the wisdom that you've gained in navigating this for yourself, and knowing that you have that you can share and help build resilience in your child. The surprise is one thing. The surprise is a big sort of acute moment of something to get through. And then often what I also hear is that once that adjustment period settles, there can just be anxiety moving into the future in terms of worry about your health or your child's health. And so I think that speaks to some of the longer term benefits of continuing to engage in self-care practices, seeking help and support if you need it, and really letting yourself engage in your community and have other friends and family who can speak with you and also offer you any tangible support in ways that they can help out with anything that you might need.
Thank you. Before we end today's session, do you have any final thoughts you'd like to share with the audience?
Just thank you for inviting me to speak with you all, and wishing you a holiday season and just a time of as much self-care as you can fit in, whatever arises for you. I wish you self-compassion and kindness toward yourself. And yeah, really grateful to be here and get to interact with you a bit.
Thank you so much for a wonderful session, Dr. Luberto. And as I mentioned earlier today, today's session is being recorded. If you're interested in reviewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Thank you so much, everyone, for joining us today. Hopefully you found it helpful, and have a lovely rest of the day.
Bye, everyone.